This video lecture is for study session 3 of NSA 303, and we are going to be discussing about conceptual foundation of community health practice. From the first study session, where you learnt about community health nursing, it is believed that by now you have full knowledge about the concept of community health nursing. Community health nursing is a concept that is synthesized with other aspects of nursing, such as public health and primary health care. This study session will focus on a broader knowledge of community health practice. On completion of this study session, you should be able to explain the concept of primary health care, highlight the elements of community health nursing and primary health care. You should be able to explain the role and responsibilities of a community health nurse and primary health care. The first contact that individuals, families, and communities have with healthcare system is known as primary health care. Primary health care refers to professional health care received in the community, usually from a general practitioner or practicing nurse. World Health Organization defines primary health care as essential care made universally accessible to individuals and families in the community by means acceptable to them through their full participation and the cost that the community and country can afford. On the other hand, we can say that primary health care is a practical approach to make essential health care universally accessible to individuals, families, and communities in an acceptable and affordable way with their full participation. Primary health care involves a broad range of health and preventive services. These include health education, counseling, disease prevention, and screening. The nurses involved in primary health care include registered nurses, midwives, community health nurses, school nurses, occupational health nurses, rural nurses, mental health nurses, and so on and so forth. Now, I know you will be interested to know what does this primary health care includes, or what types and what level of care is involved. Primary health care focused on these 8 essential elements or components. The first one is immunization. Primary health care provides through establishment of community health centers and health campaign to give vaccine to people to eradicate diseases such as measles, yellow fever, meningitis, tuberculosis, and so on and so forth. Primary health provider also ask for foreign aids in providing vaccines to eradicate diseases. The second one is maternal and child care. Primary health care providers are to provide special care for pregnant women and their children. Children under 5 years of age are also vulnerable to childhood killer diseases such as polio and influenza. Maternal and child health clinics are established in Nigeria to take care of this vulnerable group by giving vaccine to children free of charge. An example is that of Kick Polio Out of Nigeria campaign. Another element is essential drugs. There should be adequate provision and availability of vital drugs. And these drugs should be affordable. For example, there are hospitals who give free drugs for diseases like malaria, tuberculosis, and other types of diseases. They are sponsored by some international organizations such as WHO and UNICEF. Another element is food and nutrition. Basic education about nutrition should be given to individuals and families by primary health care provider. Also, education. Individuals should be educated about prevailing health problems and the methods of preventing and controlling them. For example, HIV/AIDS campaign and the acronyms ABC, which stand for abstinence, be faithful, and use of condom. This should be known by individuals in the community. Another element is illness and injury. Adequate curative measures should be provided for common diseases such as malaria with distribution of free mosquito nets, educating people about the importance of keeping a clean environment, and so on and so forth. Another element is water and sanitation, and the last one is vector and reservoirs. Vector, something like a carrier, just like mosquito is a carrier of malaria diseases. So it is the duty of primary health care provider to educate on the prevention and control of locally endemic diseases. Roles and responsibilities of community health nurse. There are 7 major roles and responsibilities of community health nurse. The first role is clinician role, or direct care provider, by providing health services to the population at large, not just individuals and family. The second role is educator role. By educating the community on health, you can enhance public health. The third role is that it is the role of the community health nurse to advocate for the patients and their groups during the time when they need someone to explain the kind of services that best suits them. The fourth role is managerial role. The role of a manager includes planning, organizing, directing, and evaluating some strategy. These roles are also performed by community health nurses when they supervise patients' care. The fifth role is case management. This refers to the order by which the nurse evaluates patients' needs and coordinates services. It involves all the steps the nurse would take to ensure that the patient's various needs are met. The sixth role is the collaborator role. Community health nurses do not practice in isolation. They collaborate with experts in many other fields, such as the physician, the social workers, the therapist, the nutritionist, the psychologist, and all other workers. So one of their role is to collaborate with all these group of people. And the last role discussed here is the research role. Community health nurse involves in inquiries, collection of data and analysis of data in order to solve problems and enhance community health practices. We have come to the end of this study session. You should consult your study material to have more understanding on the subject discussed in this video. Thank you for listening.